Ovarian cancer is cancer that comes from the ovaries. The ovaries are small oval-shaped glands that are in the pelvis. That's where eggs come from. And actually, we think a lot of ovarian cancer comes from the fallopian tubes. The symptoms of ovarian cancer are very nonspecific, and that's one of the reasons why ovarian cancer is hard to diagnose. But when you ask a lot of people that have had ovarian cancer, you find that the main symptoms are bloating, feeling full quicker than you might otherwise full when you're eating, urinary frequency, and pelvic pain. The risk factors for ovarian cancer include being born with ovaries, never having had children, and an important risk factor is being born with a gene that predisposes you to ovarian cancer. Some of these include BRCA1, BRCA2, and others. There are ways to prevent ovarian cancer. Birth control pills prevent ovarian cancer. Surgically removing the tubes and ovaries prevent ovarian cancer. And actually, we also believe that removing the tubes alone may prevent ovarian cancer. If you have cancer in your family, so a lot of cancer, multiple generations, people that are very young with cancers, ones to look out for include ovarian, breast, pancreatic, prostate. If you have a lot of cancers in your family, you might speak with your doctor about seeking genetic counseling, genetic testing, and if your findings are positive, you can speak with your doctor about maybe going on medicines to prevent cancer or having surgeries to prevent cancer. If you don't necessarily have an increased genetic risk for cancer, there are still ways you can prevent cancer. You can have something called an opportunistic salpingectomy. This is not a separate surgery to remove your tubes. Salpingectomy is removing your tubes. This is having your tubes out when you're having another surgery, and this has had a lot of success in Canada. Ovarian cancer is difficult to diagnose because it doesn't have a hallmark symptoms. All of the symptoms of ovarian cancer are really nondescript, and everyone has had at least one of these symptoms at some point in their life. If you've been diagnosed with ovarian cancer, the most important thing is that your doctor be a GYN oncologist. It's known that if you have ovarian cancer, you will have a better outcome if you're treated by a gynecologic oncologist. So that is the very most important thing that you can ask your doctor. Are you a GYN oncologist? The main treatment options for ovarian cancer include surgery, chemotherapy, and then there are other therapies. I'll call them targeted therapies that are really specific for different ways that cells are working to become cancer. And the main thing that you will decide with your doctor is the order in which these therapies are given, and this is different for different patients. Ovarian cancer is a very treatable disease. People are living longer than ever before, and they're living better than ever before. Everyone with cancer is different and requires a different treatment plan. Here at Mount Sinai, we have experienced specialists and a multidisciplinary team, and we all work together to provide the very best care for our patients.